you pay attention, you will notice that your period, your menstrual cycle, is telling you more about your overall health. That is, if you pay attention to details. In this video, I'll be sharing the relationship between diabetes or high blood sugar or insulin resistance with menstrual cycle as a woman. So, what is diabetes in the first place? Diabetes is a health issue that occurs when your body is not able to metabolize your food, to metabolize glucose effectively. So there will be release of glucose, excess glucose in your bloodstream. Why this happen in the first place? Because the organ that is responsible for this process, which is the pancreas, that's supposed to produce a hormone, which is insulin, that help in this metabolic reaction, is not producing enough insulin. And even the one it produces, the body will be able to utilize it effectively. So that is what resulted into insulin resistance. So there'll be high level of insulin in the blood. And also because it's not able to break down the food particles and make use of the glucose, there'll be elevated level, high level of blood, glucose in your blood as well, which resulted into high blood sugar level or high blood glucose level. So how does this concern menstrual cycle? The two major hormones that came to play in your menstrual cycle are estrogen and progesterone. But they are not only responsible for something, they do other things. They control your brain health, your heart health, and metabolic reactions or metabolic health as well, which is this breakdown of food particles into glucose for the body to make use of. They also come to play because they help in uptake of glucose and also in the release of insulin from the pancreas. So it makes metabolic rate easy and faster. So when they have no functioning well, what happens? There will be an elevated level of insulin in the blood, and this has been linked to an ovulation, which is infrequent ovulation. Infrequent ovulation, which is the absence of ovulation, can lead to absence of period, absence of menstruation for more than 3 months. And this has been linked to fertility issue. So how do you control this? Work hand in hand with your healthcare provider. From your own side, control your cravings every month. And make sure you track your period as well as your blood sugar level. This will give you insight on how to manage your blood sugar level and diabetes as a whole effectively, because diabetes affects ovulation, and ovulation is connected with conception and pregnancy. When all this is being controlled, you'll be able to fix your menstrual irregularity and also improve fertility issue. Like, comment, and subscribe for more healthy tips.